Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic we are going to discuss is the muscles of the anterior compartment of the thigh. Anterior compartment of the thigh is also known as the extensor compartment. Unlike the upper limb, in which the anterior compartments are the flexor compartments, in lower limb the anterior compartments are the extensor compartments. In the thigh region, the anterior compartment comprises of the muscles. The first muscle that we are going to discuss is the sartorius. Sartorius is also considered to be the longest muscle in the body, and it arises from the anterior superior iliac spine, and it is inserted into the upper part of the medial surface of the shaft of the tibia. Then comes the quadriceps femoris. Quadriceps femoris, as the name indicates, quadra means four. So there are four muscles. They arise from four different regions, but they are inserted. They have a common insertion. That common insertion is around the patella. So they are grouped as quadriceps femoris muscles. In quadriceps femoris, there are four muscles, in which the first muscle is the rectus femoris muscle, and it has got a straight head and a reflected head. The straight head arises from the upper half of the anterior inferior iliac spine, whereas the reflected head, it arises from the groove above the margin of the acetabulum and the capsule of the hip joint. Then comes the vastus lateralis muscle. It forms the main bulk. Basically, it forms the large part of the quadriceps femoris muscle. It arises from the upper part of the intertrochanteric line, anterior and inferior borders of the greater trochanter, lateral lip of the gluteal tuberosity, and upper half of the lateral lip of the linea aspera. So it has got multiple origins. It arises from all these structures, and ultimately it is also inserted in the lateral part of the base of the patella, upper one third of the lateral border of the patella, and in the expansion of the capsule of the knee joint. So it has got it arises from four different structures, and it is inserted with a common insertion with all the other muscles, that is the rectus femoris, vastus medialis, or vastus intermedius, around the patellar region. After the vastus lateralis comes the vastus medialis muscle. It rises from the lower part of the intertrochanteric line, and this is on the femur, spiral line, medial lip of the linea aspera, and upper one fourth of the medial supracondylar line. It also it is inserted into the medial border of the patella. Then comes the vastus intermedius muscle. It arises from the upper three-fourths of the anterior and lateral surfaces of the shaft of the femur, and ultimately it is inserted into the base of the patella. So these are the muscles, important muscles, that are present in the anterior compartment of the thigh, and the main nerve supply of these muscles is the femoral nerve. Femoral nerve is considered to be the main nerve of the anterior compartment of the thigh. And what are the actions? Actually, the actions of these muscles, if we take one by one, first comes the sartorius. The sartorius is the abductor and lateral rotator of the thigh. It flexes leg at knee joint. Actually, the rest of the muscles, they are the extensors of the knee joint. They extend the knee joint and help in the actions like kicking actions. All these are the rest of the muscles, that is the quadriceps femoris, or the main function of the quadriceps femoris is the extension at the knee joint, as in the kicking actions.